someone, Leo and I were talking outside, he said, you know, even Dr. Davis in there said it's okay to eat as long as you don't eat too much skin. Well, Dr. Scott Davis of Baptist Health is here, but we're not talking about eating turkey for Thanksgiving. No, we're talking about peripheral arterial disease. It's something that can affect you and affect the blood flow in your body. It's typically found in cases where it doesn't flow well to your legs, but there's also some other areas that can neck, of course. Also, your kidneys, some internal organs too, can cause some major problems. So he's going to talk about different ways to detect that and to treat it. What they can do. He said it's very treatable as long as you get it checked out.
So much in cardiac disease now that that can, you know, prolong your life.
Oh,
so
definitely.
It's amazing now.
Welcome back into Good Morning Arkansas. Dr. Scott Davis of Baptist Health here to tell us about peripheral arterial disease and intervention. Dr. Davis, thanks so much for coming in. I know we are continuing our months of talking about different diseases that affect the heart, affect the body, and this is all about blood flow.
Right. So, you know, when we hear about blocked arteries, the first thing we think about is, you know, a blocked heart artery, which is normal and it's what we ought to think about. But the same atherosclerotic process, the same clogging of the artery that can happen in the heart can also happen to the arteries to the head, you know, and increase our stroke risk, or to the legs and cause a process called claudication, which is a fancy medical term to say, you know, your legs cramp when you walk and can block the kidney arteries. And so, you know, the thing is that about 70% of people that have blocked heart arteries can have blocked leg arteries too. So we're really careful to not only say, well, sir, have you been having chest discomfort, but also, have you been having difficulty walking? Or, you know, make sure that we don't have risk for developing blocked neck arteries, so we might get a carotid Doppler, or to make sure that, you know, if you're on multiple medications for your blood pressure, we're not overlooking a kidney artery blockage. And so we want to screen for it and identify it, but then we also have means of treating it. So just like, you know, your heart doctor can go in and do an angiogram and look at the blockage in the kidney, in the heart arteries, we can do the same thing of the arteries to the legs, arteries to the kidney, arteries to the head. And so the interventional mechanisms that we have parallel that of the heart. So we can take, you know, fancy pictures of the heart circulation. We can also take fancy pictures of the leg circulation by going in through an artery down in the groin, and then this is just an animation of how we would image and then treat a blocked kidney artery. There's the kidneys there, and then there's the catheter that we would insert and take an angiogram, and there's the angiogram picture there that we can see. And then after we identify the blockage, and you can see the yellow cholesterol plaque, then we can insert a special catheter that's shaped to go straight into that area, pass a guide wire, which is kind of our railroad track, our tram track, to then put a balloon in, to then open up the artery, deploy a stent, and then improve blood flow to the kidney. And so that's what it looks like. It's a fancy video game. I mean, that's the way we do it in real life. And so this animation, I thought, was a very good example. So you can apply that then not only to circulation to the kidney, but then to the leg arteries, and also we open up arteries to the head as well. So if you have risk factors for blockage, if you have risk factors for cardiovascular disease, we want you to encourage you to, you know, follow up with your primary care doctor. Come see us at the Baptist Health Heart Institute, and we can then, you know, kind of direct you in the right way to get you screened and or treat your blockages.
Excellent. Some important things to remember there, and like you said, if you know the risk factors, if you have that risk, make sure you talk to your doctor. Always important to do that. What are we talking about next time?
So next month we've been talking about eating and Thanksgiving, so we want to talk about some heart healthy tips, right? Some of the things that we can do then that will address the cholesterol plaque and how that actually works. And so not only things that we can do to deter that, but then if it starts developing, how does cholesterol medicine really work down on the cellular level, down on that plaque that we just saw? How does aspirin work? And then what are some heart-healthy, smart things that we can do to avoid that?
All right. Thank you so much.
Have a great Thanksgiving.
You too. Happy Thanksgiving to you.
Sir.
Coming up after the break, we're going to take a look at our weekend wrap. Stay tuned.